Hello, my name is Ryan Farthing, and I'm an MSN student at Eastern Kentucky University in the NSC 890 Synthesizing Evidence for Advanced Nursing Practice class. The title of today's presentation is The Impact of School-Based Programs on Pediatric Obesity. The healthcare problem listed is the prevalence of obesity among U.S. youth was 17% in 2011 to 2014. The overall prevalence of obesity among preschool-aged children 6 to 11 years was 17.5%, and adolescents 12 to 19 years was 20.5%. The prevalence of obesity among non-Hispanic Asian youth was 8.6%, non-Hispanic white 14.7%, non-Hispanic black 19.5%, and Hispanic at 21.9%. The PICO formatted intervention question lists that in adolescent children aged 11 to 14, how do school-based programs compared to standard treatment affect body mass index within 6 months of implementation? The theoretical framework for this intervention is by Nola Pender and her health promotion model. It is a middle-range theory that can be applied to the intervention and easily adapted to the pediatric obesity topic. This theory works well in supporting the school-based intervention program. In her book, she states core principles of health promotion include participation, empowerment, holism, intersectoral, equity, sustainability, and multiple strategies. Those principles can be used to develop and facilitate a school-based intervention program. The federal level attention pediatric obesity has gained is by the National Institute of Nursing Research lists preventing obesity through interventions to promote healthy eating and exercise as previously targeted research. The U.S. Preventative Services Task Force considers obesity to be equal to or greater than a BMI at the 95th percentile. It recommends screening children and adolescents aged 6 to 18 years of age. Healthy People 2020 emphasizes increasing a healthier food access in schools and reducing the proportion of obese children and adolescents as objectives under the nutrition and weight status goal. State level interest. The Department of Public Health initiated a call to action and challenges early child care providers, educational professionals, parents, and health advocates to join them in the fight to end childhood obesity. We will review 2 studies today, the first being by Amini et al. 2016, evaluated the impact of school-based intervention would have on reducing weight gain in primary school-aged children in Tehran over 18 weeks. A sample of 334 students from 12 primary schools was selected through initial screening to find those who were overweight or obese based on World Health Organization standards. Exclusion criteria include metabolic illness, being on a diet, regular participation in supervised sports or exercise programs, taking appetite-suppressing medications. Schools were randomly assigned to the intervention or comparison group with 167 students per group. Results from the study show the intervention significantly reduced BMI Z-score and hip circumference. The second study by Fairclough et al. 2013 evaluated the Children's Health, Activity and Nutrition Get Educated Change Project over a 20-week period. The study was conducted in Wigan Borough in northwest England, UK. Eligible schools were identified within predefined geographical units. One high and one low socioeconomic status school was randomly selected with a total of 12 schools to take part to ensure diverse geographical and social contexts. All students 10 to 11 years old were invited to participate. Information from 117 comparison group students and 89 intervention group students was compiled for the analysis. The intervention group's curriculum consisted of 20 weekly lesson plans, worksheets, homework tasks, lesson resources, and an educational CD-ROM. Results from the study showed a significant difference for BMI Z-scores at follow-up. Synthesis of literature. Despite the importance of pediatric obesity is not emphasized enough by primary care providers. Reasons often include time constraints, lack of education and skill, and reimbursement issues. Traditional methods involving basic health education and physical education class in schools have not been sufficient to curb pediatric obesity. Additional interventions within nursing practice are required. These study findings encompass the importance of pediatric obesity and illustrate how nursing practice, like school interventions, can be improved to meet the needs of the pediatric patients. Application to evidence-based nursing practice. Nurse practitioners are able to see pediatric patients at all age levels in healthcare settings. For example, routine wellness visits or school exams provide ample opportunity for nurse practitioners to discuss early prevention and detection of pediatric obesity. Nurse practitioners are in a unique position to utilize their advanced knowledge and skills along with evidence-based practice, but to positively influence the health of pediatric patients. An advanced practice nurse can place greater emphasis on incorporating nutrition, education, and physical activity in a controlled environment. For example, at a school, the nurse practitioner can aid educators in teaching healthy habits and allowing children to actively participate in decision making. The environment for implementation of this intervention will be McNabb Middle School in Mount Sterling, Kentucky. Thank you for your time in watching this video presentation and following along with the PowerPoint presentation. If you have any questions, please email me or leave a comment below. Thank you. Have a good day.